Welcome to Cambridge Health Alliance Lunch and Learn. My name is Roberta Robinson. I'm Marketing Manager in Geriatrics. And today we have Dr. Ayesha Khalid, who works as a physician working in ear, nose, and throat. And Dr. Khalid is going to be talking about a very important subject, sinus and snoring. And I want to also welcome Salud Es Vida. They're our Facebook Live community. We're excited to have them on board. And so, Dr. Khalid, one more thing. If you could put your questions in the chat, and if you could just keep it to the questions in the interest of time, that would be great. If Dr. Khalid needs any more information from you, she'll ask you. So we are being recorded, just so that everybody is aware of it. Okay, thank you so much for coming on board, Dr. Khalid.
Perfect. Amazing. Thank you for having me. So I will go ahead and share my screen. And there we go. And then this is really meant to be a discussion more than anything. So I'll go ahead and present a little bit of how we in ear, nose, and throat medicine, or as some of you will see on the Cambridge Health Alliance website, it has a very long and unpronounceable name, Otolaryngology. I always say that because sometimes people can't find us as a result of the long name. I'm going to talk a little bit about how we approach snoring, sinus disease, how the two are related, and also how the two are unrelated. And then we can discuss a little bit if folks have questions about some of the newer therapies that are out there. So a lot of patients that come in that say their primary complaint is snoring, it's not something that usually bothers them. It's always, my family says I snore. I, in fact, had someone the other day that said, I've been kicked out of the bedroom. My partner says, you either stop snoring or I find someone else. That's usually an ultimatum that comes after many years of them trying headphones and buying various pillows for their spouses or significant others. So that's one category, right? That's a huge category of patients that we see, perhaps the largest in the snoring. Another category of patients is folks that come in and say, I snore and it troubles me, not just someone else, because sometimes I wake myself up at night, or I feel like I'm choking or gasping a little bit, or I get up in the morning and I just don't feel very rested. I don't feel like I sleep very well. So that's often another aspect to snoring. And then so we're getting into the category of sleep and how well we sleep and how that affects our daily life. I'll talk a little bit about snoring having many different causes. So if you think about our noses, one of the nice things about Zoom is you can show people. So if you think about your nose, people always think that noses go up, but in fact, they go straight back. So there's the nasal airway, but then there's our mouth, our tonsils, and our tongue. If someone has tonsils, that can be the issue, and it's not just the nose. And then there's our neck. It's a well-known fact that folks can weigh a certain amount. You can be at a certain weight or a certain level of fitness and gain only 5 or 10 pounds from your usual weight and have a significant difference in your snoring. And you may see your primary care doctor here at CHA, and they may say, you're fine, your cholesterol, your weight, everything is, within a normal range. If you can, get some more exercise, eat healthier, very tough with the pandemic, we understand. But for us, as ear, nose, and throat docs, we find that little bit, the first step is if you used to weigh 10 pounds less, let's say 5 years ago, and now you snore, that may be the most convenient way to get rid of it. So we often have that discussion. And then the last part I'll talk about, and I know it's a lunch and learn, so I'll show a few photos. They're not terrible, but just a warning that we'll show you what the inside of a nose looks like. The last part that we deal very specifically in, and I deal very specifically in, is that if you do have something we can see, polyps in your nose, a very deviated septum from having broken your nose, sinus disease or allergies, then that often can lead to snoring as well. So I guess what I'm really saying is if you come in and say, Doc, I snore, I think that it's really worth it to figure out why and how and at what level the obstruction is, the blockage is, because that may really help in terms of getting you better. So this actually is one of the two photos that I'm showing. When you come into an ear, nose, and throat's office, we will often look with cameras. And as Roberta and I have discussed before, that it doesn't hurt, it's not painful, it's a little odd to have someone peering all the way up into your nose and your nasal passage. And I will say one of the things that has happened with the pandemic is that we have had to evolve and keep everyone, patients and clinicians, safe. So some of the equipment we have now, which is disposable and keeps germs really from passing to anyone, which is great, happens to come with a monitor. So a lot of patients now have been able to see the inside of their nose as I'm looking, which I think some people actually like and want to see what's going on. What you can see in this photo is that the structure in the middle is called a turbinate, and the structures on the sides are really your septum and your side of your nose, your lateral nasal wall. So this is the right side of somebody's nose. And the reason this matters is you'll see on the next photo, this is someone whose picture was taken when their nose was clear, they had no sinus infections, no polyps. But if we look at the next photo, this photo here, it's the same nose, but you can see what happens to your nose in the middle of a short or long-term sinus infection. So it's a little tough to see. And I always joke around with my kids and my friends that I'm essentially a professional booger doctor. You can see the yellow. The nasal secretions in the nose are completely filling those open spaces. So on the picture before it, you see black, which is air, which we like, which doesn't cause snoring. And in this picture, you see bubbles and pus and yellow and swelling, but you don't see a lot of black. So if your nose is the cause of your snoring because of your sinuses or your allergies, then air doesn't pass and you sound as if you have a cold during the day. Family members, friends may ask you, why do you always sound stuffy? And at night, you may be someone that opens their mouth when they sleep and snores. So that is exactly, the reason I said that is even at home, you all can think about if you snore or your partner snores. If you're on this call, on this presentation today because you're trying to decipher someone else's snoring, things to sort of start cueing into are, when this person sleeps, do they sleep with their mouth closed or their mouth open? If they sleep with their mouth open, then it's quite likely that they're unable to breathe well through their nose and that is the culprit. And so the sinuses, the allergies are a very likely cause, and that's something simple that anyone can sort of check at home. Second, do you stop breathing and wake yourself up? And I'm sure all of you already know where I'm going with this, but this would be the worry for sleep apnea. Now, data shows that just taking a history that someone wakes up doesn't necessarily translate to a positive sleep study. However, as I've told even two patients last week, one of them, tall, thin, super exercising, taking care of themselves, surprisingly having sleep apnea on a sleep study, snored for a while, wasn't sleeping well. So I think the sort of stigma that we have that someone who has a thin neck can't possibly have sleep apnea, I think that's going away. And we're learning that having sleep apnea is actually very complicated. I guess I should stop and explain what I mean by sleep apnea. So snoring is just noise when you're sleeping. But what sleep apnea means is during your sleep, you either slow your breathing down or stop breathing altogether. And then your brain is not getting enough oxygen either for a second or 10 seconds or a few times a minute. And depending on the number of times that you're doing that during a few hours of sleep, you actually wake up not only being accused of snoring by your bed partner, but also feeling extremely exhausted. And many people think I'm working too much or I'm just always tired and that's how it's been. But sleep apnea, your brain not getting enough oxygen, can lead to a lot of other health problems down the road. So we in ENT, ear, nose, and throat medicine, we love to work with the primary care docs and the sleep doctors and the pulmonary doctors here to try to figure out what we can do. And I'll even mention one new service that we offer. And then the last question to ask yourself is, if you snore at night, how are you during the day? Is your nose and throat, does it work well? So for example, if you're trying to exercise or walk around or work on a computer, do you ever have to use tissues to blow your nose? Or are you constantly sniffling and having postnasal drip? Because if that's happening during the day and then you're snoring at night, again, those two are related and there may be something more going on. So I hope that helps folks get kind of a flavor for, the causes of snoring. And then I'll tell you a little bit about the chronic sinusitis part, and then we'll go back to, if you see us and you don't have sinusitis, what are the other options for snoring? So one of the things that happens with sinus disease, and the word we use, you'll often see us using in your notes, which I think patients can now see and read on Epic, which is great. You'll see rhinosinusitis. The word rhino just means nose, and sinus is just your sinus cavity. So that word is not an infection. Years ago, we thought that if you have sinus disease, you have an infection, you have pus, like I was showing you in the photo, but you can actually have a chronic inflammation leading to that level of blockage that I was showing you that lasts months and months. And it's very confusing often for the patient because they don't get a cold like everyone else that just goes away after a week. They tend to be sort of unable to breathe through their nose well for 3 to 4 months. And then they get better. And then it comes back a few months later. And that's what we define. So the goal of a patient, if someone comes in, and I'll show you the photo of who I'm talking about. First of all, do not panic. So I put this picture up to say, when people start Googling about sinus disease and treatments for sinus disease and snoring, the stuff on the internet and particularly YouTube is very scary. And they come in absolutely convinced that they need some invasive surgery and they're going to have bruising and scarring. And that is often not the case. In fact, you often don't need surgery. And if you do, the surgery is something that we do through the nose and there's no marks on your face. So let's start with that. Now, I want to get you guys, actually, as the audience, pretty savvy with what sinus disease looks like on a CAT scan or even sometimes on an X-ray. And what these photos show, it's actually going to be real easy. You're going to be experts. So let's take the one in the middle. And what we're seeing is the white is bone on a CAT scan. Gray is tissue. So here is the left side of the patient towards the right side of your computer screen. And the left side over here is the person's right cheek. And then you can see some teeth along the bottom. You can see that they've got like a little bit of a missing molar here and a root extending here. Now, all of that sound, and then here's the right eye and the left eye. So the areas, the circles that you see in the middle are the back of the eyeballs. Now, you don't have to really know much other than the following. The entire area of the nose and then the sinuses that I'm sort of pointing out here should all be black. And as you can see, they're all gray. In fact, really none of it is black, except for that little blip. So this person is completely 100% blocked. But when she came to see me, she said, I'm just out of breath all the time. Like, I try to run around with my grandkids and I don't smoke and I don't have any lung disease and I've never had asthma, but I have to pant and I sort of look as if I'm panting immediately and I run out of air. And so that's because her nose does not work at all. Now, obviously, I'm showing you a very extreme example. Most patients that come in with snoring and sinus issues are not this bad, might not need surgery, but I'm giving you the spectrum to say that it may not be that you're getting older. And that, a lot of times I tell patients getting older doesn't mean that you shouldn't be able to breathe when you're walking. There might be a very specific reason of something we can fix. So I'll shift now and I'll end with the sinus component, but I think I just always want to personally as a sinus surgeon, I'm always trying to hone in on the concept that chronic sinusitis, which often can cause snoring, is not an infection. It's an inflammatory disease. And these days, we're working a lot doing allergy testing ourselves, trying to help patients here at CHA, but then working with the primary care docs who often give a lot of the medications to help us before they see us, and with the pulmonary doctors or the lung doctors. And some of you might ask, well, but if I don't have asthma, why do I need to see a lung doctor? If it turns out that you're in that second category, as the lady that I showed, where you have nasal polyps and you need surgery, then we think of sinusitis as asthma of the nose and sinuses. So if you're not feeling well up here, you often won't feel well down here. You might wheeze or have trouble with exercise. And those two are related. And all of that will be made worse if you're snoring and unable to sleep well. So now let's jump back. Let's jump out of the sinus category and into the bucket of snoring and talk about the other things that can be done. So as we've discussed, if your snoring is related to the nose and you see us and that is the culprit, then there's a lot we can do. But if you look in and like the first picture I showed, your nasal passages look very, very clear, then what are the other options? Well, the good old fashioned option that still patients come in for has been a surgery which all ear, nose, and throat doctors hate doing on patients because it makes you uncomfortable, but can often solve the problem. And that is the good old fashioned tonsillectomy. Again, very easy for folks to tell at home. If you open your mouth and kind of say, ah, and look in a mirror, and you see that you still have these two noggin tonsils that most folks have as a child, and then they go away as you grow up, and they're touching, or the part in the back of your throat that hangs, the uvula that touches your tongue, if the tonsils and the uvula are touching and there's no space in the back of your throat, then when you come in to see us, we'll kind of shyly offer you a tonsillectomy and even trimming your uvula. But we'll tell you up front, it is a very tough surgery to recover from. You are eating soft things like jellos and puddings and soups for 2 weeks and your throat is sore. That being said, some people say, if I do not have sleep apnea, for example, and you've checked me, or it's mild, and I don't have any nasal issues, and I don't have any allergies, and you've told me I have no sinus disease, but I'm telling you I'm sleeping on the couch, or my family is just entirely kicking me out of the house because I snore so loud they can hear it from another floor, which was another patient I had last week. Then I say, okay, you know what? Your tonsils do meet criteria. We can get you not snoring zero, but maybe snoring half as loud, and sleeping a lot better. So that's one option, but that's not new. That's been done for 50 years. Here's the second option that I wanted to mention today because I think it pertains to another department at CHA. So if we do a sleep study, because it sounds like your snoring is also giving you poor sleep and or you're waking up at night, and we find that the number is mild to moderate. So remember when I said, if you snore and you sleep, but the sleep study shows that you wake up a few times an hour or almost wake up, then if that number is not too much, so for example, 10 times an hour, 15 times an hour, you may be a candidate with Dr. Lee in our dental department to have a custom device, an oral appliance, sort of like a night guard, I think of it, to cure both your snoring and your sleep apnea, which I think is really interesting because what these patients don't want to hear often is, oh my gosh, I'm so glad you came to see me. You came to me for snoring. You're not really a candidate for sinus surgery. You have sleep apnea on your scan. Go get a CPAP and wear it. And now I don't have any other options. And a lot of people say, I don't want to wear the CPAP. It's hard to manage with the tubing. It's hard to travel with, and compliance is very low. So I think the fact that we've had some great success of some patients that we've sent to Dr. Lee, the fact that we now offer this service here, and it's very tough to find it. Most places, Boston and Cambridge, really don't. There's not too many people that offer it or excited about it. I think we've started working with Dr. Lee a lot. So I think that's another great option for snoring / possible sleep apnea. Then there's newer surgical therapies, and these are wild. So let me pause here and tell you guys a quick story of what's happening in the world of snoring and sleep apnea in the marketplace. In the last 2 years, a few of the CPAP machines, I believe Philips, maybe some other companies, had a recall because of some of the material they were putting inside of the foam that kind of adheres the device. And to be honest, they were completely taken back by the government and the FDA, saying this could potentially be getting into people's lungs. That made a lot of my patients very scared and very nervous when they got that notice, sent the CPAP back. Now they're very wary of getting it again from the same company, and the company saying it's fine. So that led to the opportunity for a lot of other surgical techniques that have come about. And one of them, for example, is the Inspire technique. So if you come to see us as an ear, nose, and throat, we're increasingly becoming interested that if the inside of your tongue is falling backwards when you're sleeping and it's causing snoring, but also some sleep apnea, then there's actually a procedure you can do. And it sounds kind of wild. It sounds space age, where you can implant a stimulator that senses when the sleep is getting hypopneic or apneic, you know, what I mentioned about you stop breathing, and give you a little impulse, let's just say, so that you stop that and you start rebreathing again. The incisions are pretty minimal. It's something that we're thinking to start offering here. I think these companies and these procedures would be much more widely available in Boston or Cambridge today if it was not for the pandemic sort of slowing things down. But I think the future of snoring, and I always say sleep apnea because the two are often tied, is not here's a CPAP, go wear it, or here's some nose plugs you can put in your nose and it might help with your snoring. I think there are going to be some more permanent cures. And then, of course, don't forget that, you know, you want to make sure that your nose works well during the day. If your nose doesn't work well during the day, during normal activities, it's probably impacting you through sinus disease or allergies at night. I think that's it, Roberta. I think I want to leave time for questions. I could talk forever on this topic, but maybe we can, let me stop sharing and we can do some Q&A.
Well, a couple with the rhinosinusitis and the inflammation of the sinuses, what is the treatment for that to reduce that inflammation?
Oh, brilliant. Okay, so the photo I showed, folks will laugh because if patients come to see me for any problem, they often end up leaving with a little printout I have of a neti bottle. And I'm sure I've told Roberta about it as well, but I'm a huge fan of this. You know, it's ancient medicine, but the reality is there is clinical evidence, scientific evidence, and randomized control trials, which we all know is as doctors, we know that's the highest bar. Okay, so they take the Claritins of the world, the fluticasone, Flonase nasal sprays of the world, antibiotics, steroids, and they took the saline rinse, and they said which of these treatments is most likely to, let's say, prevent the next sinus infection. And in all of those studies, the number one thing is flushing your sinuses regularly with the neti bottle. So that has been just part of the mainstay. In fact, if you come to see me as a patient or you come to see us, we often will say that if you're not willing to use a neti bottle and potentially a nasal spray, and there's two options with that, then there's no point in doing surgery. The problems will recur and we won't be able to get you better. For nasal sprays, which I consider number two, the number two thing you should do before you would ever have a procedure is, I don't know if folks know, when you go to the pharmacy, Roberta, there's three things that are available. One is the worst thing in the world, which is Afrin. Afrin is just this immediate, quick decongestant. It was actually designed for nosebleeds, but because it's prevalent in the over-the-counter section, people use it. And unfortunately, it erodes the lining of the nose. So I say don't use that. The other two, some are over-the-counter, some are prescription, is that topical steroid sprays have the word steroid, and those are proven to reduce sinus infections and sinus disease. And they also are 99% not absorbed by your body. So I fear that because they have the word steroid, people shy away, but they actually have done safety studies. If you have glaucoma or eye disease, you shouldn't use, otherwise you can. The third one's kind of a newbie, I think, for the general public to really know that if you eat a Claritin or a Loratadine or an Allegra or a Zyrtec for your sinus or your allergies, you can actually find that as a spray. So I think of it that there are some medications like azolastine and olopatadine are nasal sprays that are the same efficacy or effect for your nose as eating a Claritin tablet. So that you need a prescription for. But I think those are where I start. You should be doing that regularly every day for at least a month to just see if you can get rid of your problems. And then we go from there.
So in the neti pot, using the use of the neti pot on a regular basis every day?
I like, yes, the neti, and I like the bottle. Some people like the pot, but to be honest, with the pot, you have to pour and turn. It's not super easy. If you're like me and you're trying to rush through the day, you're going to get it in your throat or your ears. So I like the bottle. You put it in and you just squeeze the bottle gently, and then you don't have to turn your head. I think doing that every night before you sleep is a great way to cure a lot of your snoring even.
Great. And so to get a device that you might need, you would have to be fitted for one. You can't use a generic device. Everyone needs, right?
This is a great point. So it's not that you can't. There's several levels. Number one level usually doesn't work. I went to CVS, I got a mouth guard, and I saw that it was advertised for snoring. Generally doesn't fit well. People don't find improvement. The second is there's a lot of online companies that mail you a device, like they'll mail you a guard and then you have to heat it, sort of like how kids use in sports, and then fit it yourself. I found that to be hit or miss. The one that I mentioned in my talk is a custom fitted device, and you do need an appointment. And we have one person at CHA, one very busy surgeon. But ever since Dr. Ryan Lee came and brought this service, I used to struggle with where I could send patients to get an affordable device that could help their sleep and their snoring. And I think that is starting to work now here.
Great. Now, I have a couple of questions. And one of my questions, and you may have touched on it, that laser procedure that I've read about, did you touch upon that? I know you touched upon that implant, which also is intriguing.
No, I didn't. You reminded me. So there are a few things. And again, it's all about what the inside of your mouth looks like. But there are definitely laser procedures that can reduce. Remember when I talked about if you go home and you look in the mirror and you look at your tongue at the back of your mouth, for example, and you look at if you have any tonsils or a uvula, there are laser procedures you can do to reduce the back of your tongue, for example, so that if your tongue and the top of your mouth are touching when you snore, that type of laser procedure reduces the bulk and then it no longer touches. Snoring comes from touching, when tissues touch and vibrate together. So that is one example of a laser procedure. Another thing that has been happening is that people have been using lasers as well as different materials, maybe silicone implants to, this is going to sound funny, but it sounds like working out, to bulk up people's palates so that they'll do it in the top of their mouth, kind of if you touch your tongue to the roof of your mouth, because when they look in, they say, again, if I bulk up your palate, it's not going to touch. So now that's the pro. I will personally admit I'm not a huge fan of the laser because what folks don't know is lasers are very hot. Like the intensity generated tends to make it not an easy recovery of a procedure. And a lot of tissue has to sort of slough off and heal. So you've got to be a bold, brave patient to have a laser procedure for snoring. And if you guys Google it, you'll see that not many ENTs offer it anymore. It was really, really hot. It's starting to come back because lasers have evolved so that they're more comfortable and they have the moisture. But we're not doing that particular procedure at CHA yet. And I think I would definitely err towards oral appliance and like Inspire before personally I would do laser. But it may be the referrals that I'm seeing.
And let's go back to that implant on the tongue. I think you said that little sensor. It gets
Yeah. So there's actually an incision that you make like down here. You actually, it looks, I think of it like, you know, some people get pacemakers, right? And they have implanted lower down. And it's the same principle, right? The pacemaker thinks, is your heart beating at the right time and consistently? Well, similarly, what this does is it's basically stimulation of nerves that sense if you are not constantly breathing and re-stimulate that hypoglossal nerve to get you to start breathing again. But not a treatment for just snoring, right? So you'd have to have snoring with some element of sleep apnea for these newer devices. I think with the recalls on the CPAPs, and to be honest, I think it's yet another example of some companies that knew that there could be potentially damaging effects of having this material going into people's lungs. So I think if you ask me my opinion, there's going to be a lot of scrutiny of CPAP machines and CPAP companies moving forward. And that's going to be a good thing for patients, but it's going to be making it harder and harder to get one, which I think is going to make these other procedures you're talking about a lot more popular.
And always you would have to be assessed, evaluated to see if what procedure might be the most beneficial for whatever condition you have, correct?
Absolutely. I think having your primary care doctor know, I guess this is a really good point to say, time to say something that I forgot to mention at the beginning. If people don't sleep well, nothing else goes well, we find. So the underlying denominator, even lower than snoring, is sleep. So if you are snoring, we consider that sleep disordered breathing. Your natural way that your body sleeps and your brain feels the most rested and you feel the most recovered is if you don't snore. Now, that being said, it doesn't mean snoring's terrible or is always going to have bad side effects. But I think what always I find remarkable is snoring and poor sleep and it getting worse over the years. And folks feel like that's just how I have to live versus there's a lot of options to not only get you snoring better, but get you sleeping better, which is going to impact your mood. A lot of patients come to me to say, oh, I snore and my partner says that I'm always cranky. And to me, that's an immediate sign that you're snoring and you're not sleeping well, and it's affecting the rest of your day and it's affecting your work.
So, and of course, getting any of these appliances would be first primary and a referral to you, a specialist.
Yeah.
So some of these, like the guard,
Yeah.
can that come from the dentist, or does that necessarily, or both, or either or?
No, I mean, I think in order to get the oral appliance, imagine the patient journey would be you see your primary and then you get a sleep study and it's positive. The result is not bad. It's mild to moderate. Your primary sends you, in our case at CHA, to Dr. Lee. You talk about an oral appliance. So that's one possible stream. What often happens is you see your primary, you say you snore, but you say, I've always had trouble breathing through my nose and you've given me sprays. And in my case, it hasn't worked. You come to see us and we say, oh my goodness, you have so much more than that. And then we offer you options. If you don't need a nasal procedure and it's your mouth, I often say, would you prefer to see someone for an oral appliance rather than have me send you off and say to get a CPAP. That's become sort of my standard line because as as a lot of my patients that are young say, it's not very sexy to sleep with a CPAP every night. I look like an astronaut and I'm trying to date. So, I mean, there's very practical life considerations around what we tell patients. Or before the pandemic, patients would say, I travel for work. And when I get to the airport and I carry my CPAP, I always look like I'm carrying a bomb. So I'm not saying CPAPs are not useful and life changing, but I'm saying it doesn't help if the patient doesn't wear it and it's just sitting in their house.
Right. And they are cumbersome, right?
They are cumbersome.
So I think we've answered all of the questions in the chat, but I have one more question. And there's recent research about a connection to sleep apnea or snoring and Alzheimer's. Now that, of course, sends everyone, because everyone fears getting Alzheimer's. So can you talk a little bit to that? And then I know we've gone over, and thank you so much.
Oh, yeah, absolutely. I'm so sorry. I'm a talker. Yes, let me talk about that very quickly. And absolutely right. As clinicians, we have been worried about snoring, especially snoring plus sleep apnea for 15 or 20 years. And my standard line to the patient was, I'm not asking you to get your snoring/sleep issues fixed because I'm worried that you won't breathe perfectly through your nose or that your partner's upset. I know that's what brought you in, but I am worried that you're going to down the road possibly get high blood pressure, have a heart attack, have a stroke. So we had that in the back of our mind. To me, the Alzheimer's data, which has been very strong and says that patients who had a history of snoring and or sleep apnea, or snoring with some sleep apnea, I should say, had more plaque deposits indicative of a further stage of Alzheimer's than patients who didn't. So as we all know, when we read about Alzheimer's, it's such a confusing and complex disease because everybody's wondering what predisposes me to getting it and what can I do to not have it. And I have some patients that do crossword puzzles or do the New York Times every Sunday. But now we have some concrete data that if you snore and you have mild sleep apnea and you were told in the past, you know what, if you don't want to wear a CPAP, no big deal. Now it's a big deal because now it's not next year or 2 years or 3 years. You may in 10, 20, 40 years develop Alzheimer's and have more plaques as a result of it. So I think you're right, Roberta. And I don't know the neurologists, the community of doctors that treat Alzheimer's the most, they might have to really interplay now on the treatment of sleep to get people, interested in treating something that isn't always fun to treat.
Right. Everything is connected to everything, right? It seems that way. Well, just one more quick little question. And when we use the simple saline solution with the neti pot or the bottle, it's at night would be more effective if you're one that's
I'll say something funny. So I said at night for the following reason, because I don't want the people that are on this chat to go ahead and use it in the morning and then go off to work or get on their Zoom. What happens is when you first learn to use the neti bottle and you have allergies or sinus issues and you lean over, snot water comes out of your nose. So it can be embarrassing if you're at a meeting or seeing a patient or a lawyer at a presentation, as I once had. And it's a lot of water. So you might have like a half a cup of water come out and people say, what is happening? So that's why I say use it at night so that all of those social things don't happen to you during the day.
And that's a very good point. Well, thank you so much. I think the comments we're getting, this was very helpful, very informative. Great. It seems to be a very hot subject. And so thank you so much, Dr. Khalid. I just want to remind everyone that the first Wednesday of every month, we do our Lunch and Learn. And next month, we have Dr. Raj Pike. And Dr. Pike is going to be talking, he's an autoimmune specialist, rheumatologist. Awesome. So he's going to be talking about all the autoimmune, or several of them in any event. And the date of that is March 2nd. So I hope to see all of you then. And thank you so much, everyone. Thank you, Dr. Khalid.
Thank you for having me.
And we'll see you next month. Thank you, everybody.